Here we go. Hello, everybody. Dr. Kevin Connors, and today we're going to talk about lymphatic congestion first. So, lymphatic congestion is a real problem with a lot of people, not just with patients with cancer. So, let's talk about that. First of all, what is our lymph system? So, our lymph system, you have lymph nodes. Everybody's heard of lymph nodes, especially if you had cancer, because maybe you had some of them removed. And you have lymph vessels. Your lymph vessels are best maybe described, I like to describe them as kind of open-ended sewer systems. They're open-ended capillaries that drain your extracellular space, extra outside cellular space. So the space between the cells has to be drained because your cells have metabolic processes that are going on, all sorts of different things happening inside that cell. Remember I said, think of a cell as like New York City, all these millions of different events that are taking place that produce a lot of waste. And the cells give that waste off into the space between the cells. That's the extracellular fluid, which can become very viscous. It's not fluid, so that's why you don't just cut yourself open and you spill water all over. It's very viscous material that then is drained by open-ended capillaries, and I think they're best described as like your storm sewers on the street. So when it rains really hard, would be considered maybe as your cells are giving off waste. That waste then runs down into the sewer system. And the sewer system could be best described as the vessel itself. And then it's carried through the lymph vessel, ultimately back to the arteries. But it goes through these things called lymph nodes, which are concentrated areas of a lot of white blood cells, macrophages, T cells, lymphocytes, to kill anything that's in that waste, because we don't want to be putting bacteria dumping that back into the bloodstream, the vascular system. So we certainly don't want that to go back into the venous circulation. That's going to cause disease elsewhere in my body. So the lymph nodes kill any infections. It's not going to kill any toxins, but it's going to kill any infections. And then if the toxins that are dumped out of the cell into the extracellular space, picked up by the open-ended capillaries, the storm sewers, carried through the duct system, the lymph vessels, go through the lymph node, kills off any bacteria or viruses that are in there, then dumps it into the venous system, which then goes through your liver and helps filter out any toxins. So your liver, your kidney help get rid of the toxins that are in that lymph that's carried out of your extracellular spaces. So that's the purpose of the lymph system, is to clean your body. So if we didn't have storm sewers and we lived in a city and it rained 6 inches, we'd have water backed up in our yards, it'd be backed up into our basement and make a mess. We would become toxic if that had no way to get out of our body. So we would become toxic very quickly. So the idea sometimes in the practice of medicine as far as oncology goes is, well, your lymph system carries things around your body. And well, if we have, let's say, breast cancer, those breast cancer cells can go into the extracellular space and through the lymph system to the rest of the body. So maybe we should remove the sentinel node. We should remove any lymph nodes. If we get rid of all the lymph nodes, then the cancer cells, the circulating tumor cells, can't go through the body. I guess that makes sense in one sense of thinking, but the problem with that is by the time your cancer got to the size that you're even considering surgery to remove the cancer, let alone the lymph nodes, you've already passed millions of circulating tumor cells around your body. So in that understanding, it makes no sense to remove all your lymph nodes. I'm not saying that a person shouldn't remove a lymph node that is cancerous, but when a person has lymph nodes near a cancer site, and then the debulking of the cancer surgically occurs, and the surgeon decides to take 5, 10, 20, 30, 40 lymph nodes out to test them to see if they're cancerous, and then 2 or 3 of them are cancerous, you removed a lot of your drainage possibilities. And when you remove the storm sewers, that's when we can have the problem with backup. And that's where we have the problem with lymph congestion. So there's other reasons why, and we'll go over that. So if the person didn't have any surgery, didn't remove any lymph nodes or lymph vessels, and is still having lymph congestion, we'll talk about why that might be. But certainly I don't agree with the idea of removing a whole bunch of lymph nodes to see if they're cancerous. The problem is when you look at it from a surgeon's point of view, you can't see if something's cancerous unless it's grossly grown cancer around that lymph node. It could be just, thousands and thousands of cells inside the lymph node still isn't visible. It has to be millions and millions and millions of cells to be large enough to be visible. So they're not, from their understanding, it's like, well, we don't know if that is cancer, so we're going to remove it. And they're just trying to take this scorched earth approach to getting rid of your cancer, and it can leave a person sometimes in a worst case scenario afterwards. But their thought is, well, we're just trying to save this person's life. So your lymph system is vessels. So you got vessels and nodes. Let's talk about the vessels first. So again, think of the vessels, the open-ended capillary draining that extracellular space back into the bloodstream, cleaning it out. It's your drainage system. So the issues that you can have is you can have blocked vessels. So what can block your vessels? Excess waste can block the vessels. Exotoxins can block the vessels. Large proteins, large particles, large toxins can block the vessels. So different things can happen to block those vessels to cause extra lymph swelling down or upstream from that. So when we're talking about lymph swelling, we're usually talking backstream or upstream from the lymph vessels because the lymph vessels are draining it. Damaged vessels. So I can have damaged vessels from surgical damage or surgical removal of lymph nodes and vessels. I can have damaged vessels from wounds. So this is what I was talking about. So if I have surgery to debulk a cancer, and then I have surgery to debulk multiple lymph nodes or remove my sentinel lymph nodes, then I'm going to have backup upstream. I'm not going to drain that area very well at all, and that's going to be an issue, and it's sometimes difficult to overcome. I can also have compression on vessels downstream. So compression is what, let's say I've never had surgery, so why am I getting lymph swelling and excess swelling in the tissue when I've never had surgery? So even a person that sits all day at work, you have compression. So let's get to a picture of how my lymph system drains. Let's jump down here. So my lymph system drains this way. So let's say I get swelling in my legs because I take off my socks at night, and my goodness, I can see the lining of my socks on my ankles. Why is that? I never had surgery. I never had any lymph nodes removed. My lymph vessels are still intact. I don't have large cancer growing in my abdominal area that is blocking it. Why would that possibly be? Let's say a person doesn't even have cancer and they have swelling in their legs. Well, can be due to diet. We're not going to get into the diet and salt issue on this talk, but we're talking about blockage. It can be due to compression. So a person sitting all day, these vessels have to drain back up here into the inferior vena cava in the abdominal cavity to get back to the heart. So if there's compression in the inguinal area, in your legs and hips area from sitting all day, that can be an issue. Also, the lymph system does not have a heart that pumps fluid through these vessels. So let's go back to a picture here. So the way that the water runs in your storm sewer is simply by gravity. So if you have a storm sewer that's on the top of the hill, that would make no sense. You put the storm sewer at the bottom of the hill so water can run down the hill and go into the storm sewer. Otherwise, we're going to have a big puddle of water at the bottom of the hill. Well, sometimes that's what takes place with our legs. We're sitting all day, we're not getting up, walking around, because it is actually the contraction of the muscles that pushes the fluid through the veins. How is the fluid going to exit my feet down here if I'm standing all day or sitting all day and get back up to my heart? I don't have, my blood system has my arteries that blood is pushed through my arteries, then through my veins, back up to my heart. But my lymph system doesn't have a heart. It relies completely on the contraction of the muscles in order to push the fluid through those lymph vessels. The lymph vessels have little valves in them, one-way valves, so the fluid can only go one way, but it is very dependent upon contraction of the muscles to push the fluid through those vessels. So even a person has completely intact vessels and no blockage upstream, they could get swelling because they're not contracting their legs. They're not moving their legs. They're getting compression from sitting all day or something like that. So it's very valuable to get up, walk around, do some leg toe raises, contraction of your muscles. If you're sitting all day, write the alphabet with your feet, move your muscles, contract muscles, move your body in order to get that compression off and get the vessels moving the fluid through through the vessels themselves, using the muscles. Then issues that you can have with the lymph nodes themselves. So a lymph node can be swollen and it can be hypertrophied. And we want to kind of distinguish the two things a little bit. So often when we used to treat a lot of kids, the parents would say, my son has got enlarged lymph nodes in their neck, typically after a cold or a flu or some sort of virus that they had. And the parent was all concerned because this lymph node was rather large in the person's neck. So back to a picture of lymph nodes. You have all these lymph nodes in your head and neck and under your jaw and down your neck, and that's what drains your head. So if this child has a really bad head cold, that virus is going to drain down and that fluid is going to drain down those posterior cervical and anterior cervical lymph nodes, and you can get a giant enlarged lymph node. So a lymph node can enlarge or hypertrophy because it's increased the amount of lymph tissue in the lymph node. Meaning, in the case of a bad infection, your lymph node can enlarge, hypertrophy, because you're adding a lot more white blood cells to be able to kill that infection that's there. And sometimes in children, it never goes down and they just grow into it. Sometimes it'll take months for that lymph node to go down. Never should you massage that lymph node itself. Never should you try to push on it or try to worry about pushing that lymph node or touching that lymph node to get it to go down in any way. So leave it alone. That lymph node is enlarged for a reason, many times a good reason. There's a lot more white blood cells there to help kill off any infection that is going through it. Remember, the lymph node is killing any infection from the toxins or the viruses or the bacteria that are going through the lymph vessels. So a swollen lymph node can be from a different reason. So the lymph node can be swollen, typically you see that in adults, because of upstream waste. So if a person is, let's say they have breast cancer, and now they have swollen or enlarged lymph nodes in their axillary area, in their armpit. And they're concerned whether, is this a swollen lymph node or a hypertrophied lymph node? So when we talk about hypertrophied lymph node, we're talking about post-infection. Okay, so can a woman get hypertrophied lymph node in her axilla post-infection in her breast from breastfeeding? Yes, you can, but it will typically disperse within a few weeks and there won't be an issue. A swollen lymph node is from clearing waste from an area. So let's say a person, back to the breast cancer example, has a swollen lymph node after doing chemotherapy. That's not that uncommon because chemotherapy kills cancer cells via lysis, and killing via lysis is going to produce a lot of exotoxins, which is going to have to be carried away, and they can get a swollen lymph node because of that. Again, I'd say maybe it's good to just leave that alone and let your body clear that out. Work downstream from there to help clear that out. Second reason why you could get swollen lymph nodes or enlarged lymph nodes is pathological enlargement of a lymph node. So a lymph node can enlarge pathologically because there's cancer in that lymph node, and that's what we're concerned with any history of cancer. So always with any history of cancer, we tend to jump to that conclusion. I got a symptom, my neck hurts, do I have cancer in my neck? Well, I guess it's not wrong to jump to that conclusion because we're trying to be safe as possible in our differential diagnosis, given our history that we have, but it's not always the right answer. So it's not always the reason why we have, a symptom. But when we have an enlarged lymph node near the site of the cancer, that's always a concern because is that a chance that the cancer is growing more in the lymph node? That's a possibility, and that's where the only way to know diagnostically for sure is to get a biopsy of that lymph node to know if that's what's going on. So what do we do about these things? So first of all, if you have blocked vessels, we want to know why, or damaged vessels why, or downstream compression why, because there can be some pathological things that are going on with that as well. A person can have issues from sitting and inflammation in the blood vessels as well, especially in the venous system, that really needs to be addressed. And many times antibiotics are in order. So you do want to know why this is going on. You want to be asking those questions, why? Understand the anatomy at least. So understand the main points of the lymph system. You can compress a lymph vessel. The lymph vessels have very little contractile tissue in the vessels themselves, so they're easily compressed and blocked. The only way fluid moves and waste moves through the vessels is through the action either of gravity, which is a bad way for lymph to move through it, or the best way is through contraction of the muscles. So if you have swelling of the legs or the hands or anything, make sure you start by making sure there's no compression. That is moving your body, getting some motion in your body, and getting some muscle contraction. Do muscle, just some little calisthenic type exercises. It can be anything from pushing up against a wall to doing leg raisers to writing the alphabet with your feet and then with your legs. Just get your body moving. You don't have to go for a 10-mile walk. Just get your body moving. Now there you can do, we've talked, there's other people that have talked about doing lymphatic massages. And is it safe to do a lymphatic massage? Yes and no. You do have to be careful doing a lymphatic massage. You'd want to go to make sure that you go to a massage therapist who is really specializes in lymphatic, in cancer massages. So we used to have a massage therapist that worked for me years ago, and she went and got some extra training in cancer and dealing with cancer patients. I think it's important to make sure that the massage therapist, because there's a lot of different schools of massage therapy out there, and maybe some that don't get a great education, that you don't massage the lymph node, nor do you try to press on an area that's too close to cancer. So you just be careful of that. We've had people say they've got a lymphatic massage that was terrific, and other people say they went to a massage therapist, got a horrible, then they felt worse afterwards. So just be careful who you're going to. And then there's some nutrition that you can use. We have some lymph stem liquescence and some lymphagogue compound, and then there's another supplement that we have that's probably very underused. It's called Herb Diuretic. It's a herbal diuretic to help the body flow. And you can use medicinal drug diuretics as well. That can get fluid moving out of your body too. But I'd always like to go an herbal approach if we can do that. If you have swollen lymph nodes, you can still use any of those therapies as well. And then there's other things you could do, support the pathways, other pathways of detoxification. Think of like using sauna. Remember, Your lymph system is a way you detoxify your extracellular spaces. Now, it's going to bring it back to the bloodstream, and then the bloodstream is going to bring it to the liver and the kidneys. So you're going to be stressing the liver and the kidneys, the more toxins or the more detoxification that you're doing. So if you could use the foot bath, a sauna, castor oil packs can help. Coffee enemas can be extremely beneficial. Heat, and can you use heat right over a node? Yes, but be careful on the temperature that you're using. Make sure you're not getting too high of heat. Also be careful, a little caveat here, be careful with the heating pads that you're using. Even if you're using those nice jade or tourmaline heating pads that are infrared heating pads, you could burn yourself with those. So be careful with that. And especially if you fall asleep or something, make sure you put a towel underneath that or put some clothing underneath that so it's not on direct skin. You don't want to burn your skin. Be careful with that. Essential oils can be beneficial too. And there's many different essential oils to try. We typically tell people make sure that you use a carrier oil. Hot oils can cause sensitivity on the skin. CBD oil can be really beneficial. I didn't put on here, DMSO can be really beneficial as well. And again, I can't overemphasize exercise and getting motion. So getting up and moving, getting some exercise, getting that muscle contraction is going to be really good. Changing your sleeping position. Many times it's the person's sleeping position that's causing the issues. Sitting position. Avoiding compression, meaning being in one position at any time. You could use compression upstream. That means like compression socks. Using gravity to your benefit. I've even had people get on the floor on all fours, like you're going to crawl around on your knees and your hands, and just relax your tummy. So all the lower extremity lymph nodes have to drain into the abdominal cavity, and they drain into and ultimately empty into the venous system called the inferior vena cava that drains back to your heart. And if you have any fluid in your abdominal cavity, or if you have a mass, a tumor mass in your abdominal cavity, that's putting pressure down on the inferior vena cava. So while I'm laying on my back and I'm raising my legs are raised so that you think would be good because I have it in an anti-gravity position, so my legs should drain. But if I'm laying on my back and my legs are raised, and I have any fluid or any mass in my abdominal cavity, that's going to put even more pressure on my inferior vena cava, and nothing's going to drain down from my legs. So it's like, why aren't my legs draining? Well, maybe the better thing to do is to stand up and walk around and exercise, and then get on all fours on your knees and your hands and allow your tummy to sag so that it opens up your inferior vena cava. Your vessels are just soft tubes. They're not like hard, metal tubes or hard plastic tubes. They're just soft tubes. So you can push on them just like on the back of your hand. If you push on your vessel, it just squashes down. Well, that's what takes place in your body. So any pressure on there for any reason, like, oh, my legs are swollen. Well, it's just a whole negative loop that you get into, because your swollen legs compress your lymph system and don't allow the lymph to drain through your legs. So it's something that could get worse really quick. So do we sell, some questions that came into the chat. Do we have DMSO? Yes, we have the DMSO with the zinc, that DMSO zinc spray that we use. Is the lymphatic drainage pattern the same on both sides of the body? Now this picture shows that it's the same on both sides of the body, and here's a bigger picture of it. But it doesn't actually go exactly like this, because actually the whole person's right side of the body, the head, the entire head ultimately drains down to the right lymph node right above the breast, and the right arm drains to the right lymph node, and then the entire left side of the body and the abdomen and the right leg drains up to the left lymph node that's right above the breast. That's just how it drains. It's just a little bit different like that. But generally, this gives you an idea of the direction of lymph flow. This is correct in the direction of lymph flow, so it gives you a good picture that way. Other things that you could do, check checking Rife frequency. So ultimately, if the cancer is in the lymph node itself, well, do we want to drain it? Yes, we want to make sure that we get drainage, but we want to make sure that we're running the right frequency. So most of you know, some of you don't know, that Michelle and I are doing a constant, never-ending studying on what to do to help our patients. And one of the things that we've come up with in the last couple of months is adding a lot more frequencies to a person's program. So a lot of people's programs, instead of being just a week-long program, are now turning into 2 or 3 week program that they're cycling every 3 weeks. They're running a different frequency. So they have an A set, B set, a Monday A set, Monday B set, Monday C set, if it's a 3 week program. Because we're testing for different frequencies that might be also beneficial for that person's cancer, and that can change. So you can ask about that. So if your cancer is going the wrong way and you're starting to get more swelling, make sure you ask us, call us, ask us, or Facebook us that you want us to check and do some distance testing on you to check and see if adding some more frequencies would be beneficial, and then we can send you a flash drive for you to update your Rife program so that you can get those new frequencies in. Secondly, rechecking your supplements. It's always good if we're not going in the right direction to make sure that we're doing the right thing. Do we need to add these lymph detox things or not? What do we need to do? And then using other therapies. Is the PEMF good? Yeah, that could help with lymph system flow. Absolutely. Can HBOT help? Well, HBOT's not going to necessarily help with lymph flow, but it's going to help with other things. The LBG, the light beam generator, is one of the tools that are, if every patient was local, I mean, and you have lymph congestion, you're going to be doing the LBG. That is one of my favorite lymph congestion tools. The other one I forgot to put on here is the acoustic. The acoustic is great for lymph congestion. So anybody that's got really bad lymph congestion, just move to Minnesota, especially this time of year. It's just perfect. And we'll get going on the LBG and acoustic. And I wish I could be completely serious about that, because those tools are really great tools for lymph congestion for people. Question, are there lymph drainage frequencies in the custom Rife programs you sent? No, because there really isn't a lot of lymph drainage frequencies, but there are, when I talk about rechecking Rife frequencies, it's to help me kill the cancer. So again, if I have cancer in a lymph node and my lymph node is getting larger and it's not draining my tissue, or my cancer in my abdominal cavity is getting larger and that's why my legs aren't draining, we have to fix the why, remember. So fixing the why is to see how we can, any way we can tweak things, get more aggressive, any possible way to help kill the reason why, the increased growth of the cancer. And that's why we would be checking the frequencies. Question, is there any way to do the acoustic and the LBG at home? No, there isn't. The acoustic therapy is completely cost preventative to do anywhere. I mean, that acoustic therapy equipment is over $100,000. And the LBG, that's possible. Those are purchasable, used at a decent price. New, they're $15,000, but you can get them used sometimes. I've seen them on eBay sometimes, not very often. But the light beam generator is a great therapy that for lymphatic detoxification. Hyperthermia is good. That's where hot packs, cold packs can be beneficial. Sometimes it's good to pulse hot and cold. You put a hot pack on, then you put a cold pack on for 2 minutes, and you put a hot pack on, and you put a cold pack on for 2 minutes. Sometimes pulsing the body can help move lymph better. And other therapies like IV vitamin C and ozone can be beneficial too. But really, the most common thing that's going to help with drainage is you have to deal with the reason why. Is there compression? Is there growth of the cancer? Secondly is exercise and motion. Those are going to be the key things to dealing with lymph congestion. Okay, I'm going to unmute everybody and open you up for questions. So you are unmuted unless you muted yourself, which a few people I see did, which is just fine. If you got babies crying in the background, I appreciate that. But if you have a question, make sure you hit your unmute and then you can give me your questions. Nobody? Doesn't have to be on this topic.
Dr. Connors, this is Janet Kissling.
Yes.
I'm so sorry. I was supposed to send you questions and it just has not happened. But I am beginning to think that maybe some of my problems have been that my body is having an allergic reaction to oregano. Because I've been using that tooth and gum oil.
Yep.
And my gums are doing what I have had in the past with myrrh, and I'm very allergic to myrrh. Okay. So I just feel like ripping my teeth out of my mouth. Okay, so that was starting to happen, and I started recognizing it. So I quit doing that oil.
Good.
My gums are much better.
Good.
But then I started thinking about that because I've been still dealing somewhat with the bladder issues. I've gotten it to go quite a bit. It's quite a bit better. And so I started looking, I looked at the HPLR. It has oregano in it.
Yes. So if you have a sensitivity to oregano, you can't use that. So
I took it out. I have not had any of it since Saturday. And it's been getting better and better and better.
Oh, good. So you might have knocked the H. pylori out already, but then now you just have a sensitivity to oregano.
I don't know, because I'm still dealing with, okay, so I'm sitting here right now with a liver pack on. When I put the heat on my liver like that, right in the areas where I still feel real weird sluggishness, like that snake feeling.
Okay, so the other way to kill the H. pylori is to use just straight berberine.
Okay.
And we have the Berber Clear.
I think I'm on Berber Clear though.
Yes, you are, but just increase your dosage of that then.
Okay.
And then you can run the H. pylori frequencies on the Rife.
Yes, I've been doing that, and I really do think that helps too. I've been trying to do that. It just takes a lot of time every day.
It does. It does.
Okay, so, and I really appreciate what you had to say about this lymph. So I have a lymph node in my armpit, actually a couple of them that are quite, swollen up, and they were getting bigger and smaller. But I feel like that since I got my new frequencies that you sent, that definitely there's definitely something that has happened, that it's doing better. So I really appreciate that.
Well, that's good.
Yeah. So thank you very much. I really appreciate it, and I'm still working through these things, and I thank you so much.
Oh, you bet. Keep up the good work.
Mm-hmm.
Hey, Dr. Connors. How are you?
Good. How are you?
Doing great. I had a question about, I think Sharon asked about IPT chemotherapy.
Yes.
And I was just kind of curious about, IPT versus full, why someone would go IPT, or, and then would IPT still have a lot of the residual, like raise your chance for reoccurrence and things like that, that the full,
So the benefit of IPT is just stemming off the cancer. All cancer, even if it's not completely glycolytically driven, is still gonna uptake insulin. So just taking that information and going, okay, well, why can't we just dose insulin to this person and then give a smaller dose of the chemo right afterwards? And the chemo will just drag right with the insulin into the cancer cell, and we'll get the same effects on full dose chemo by using a much lower dose chemo plus insulin. So all the studies and the testimonials of patients doing this are mixed results. And I say mixed results, meaning that they're really the same results as if a person did full chemo, which are mixed results. So there's no guarantee a person does chemo that the chemo is going to work. Why? Because the chemo doesn't always work. So it just doesn't. It's just like anything else. It's just not always going to work. So will insulin potentiated chemotherapy work? No, it's not going to always work either, because it's still using chemo as the killing agent. Now, the question is, why would a person do, question really shouldn't be why would a person do insulin potentiated chemotherapy? Why don't they just do chemo? The question is, why would anybody do chemo? Why don't they just do insulin potentiated chemo? Because if it's going to work, it's going to work, and they're not going to have all the side effects.
Right. That makes sense.
You'll also have some side effects because it's still chemo, but it's only about 10% of the chemo. So you're going to have much decreased side effects, much decreased, ill effects long term than if you did full chemo. And by any mathematical genius looking at case studies, you're going to have just as good a chance and success at insulin potentiated chemotherapy as you're going to have at chemotherapy. That's just the facts that are out there. So if you're going to look at chemo, the best way to do it is to do insulin potentiated chemo. Now, the other downside of doing insulin potentiated chemo is that typically your insurance isn't going to cover it. But if you do chemo, your insurance covers it.
Okay.
So that's usually the decision-making factor of people. So where do I go get insulin potentiated chemotherapy? That's another factor why people don't do it. Oh, I have to go to Arizona, to this clinic in Arizona and do it. Well, I want to work at the same, I could get chemo at my hospital down the street. So what am I going to do to get insulin potentiated chemo? It's still like the same protocol. So I have to go stay there for 3 months. Yeah, you do. Or you're going to have to fly back and forth, So there's all those type of factors on why people don't do that. Cost, travel time, staying where, all those different things. But from a health standpoint, it's much easier on your body. You have just as good a chance of it working as you would as the chemo working, and you're not going to have any of the side effects, or very few of them.
Right. Because I feel like because, my score jumped so much, the tumor still seems to just be growing without really much, stop, that I'm just kind of starting to look into options like that. And, I was kind of wanting to know what you thought about that. I have just recently been recommended a clinic in Atlanta called Advanced Center for Medicine. I think Jonathan Stagel is the doctor there. I don't know if you're familiar at all with that facility or anything. But I know that's what he does, the low dose insulin potentiated chemo with dextrose or something. And then he does like PEMF, and he does a lot of these other supportive things.
Yeah, there's just not that many clinics that do that. So that's
right.
That would be closer to you. That's a lot better.
Yeah, that one's about 4 hours away. But I mean, we would have to, we'd have to stay down there in like a Airbnb or something like that. But we were kind of starting to play with that just because I feel like I'm going in the wrong direction. Is it time to just up the aggressiveness to hopefully reverse, or should I give it a little more time? I think the IV gene score would just kind of put me in a little more of a like, hey, wait a minute. I didn't know, why am I moving so fast in the wrong direction? It was such a big jump. So it was a little bit of a...
That's where you need to start asking those other questions. Do I need to do something different?
Right. Right. And that's what we've been asking. And, you know, I really like chemo just freaks me out because you hear all these like residual effects of it long term. So I'm like, can I just do like IV therapies instead? You know, would that be enough? You know, but I guess for me too, anytime I ask or consult with anybody outside of Connor's clinic, they're like, triple negative, you don't want to mess with that. It is the most aggressive cancer. It doubles overnight, you know, like in size, and you really need to be serious about this. And it's kind of intimidating, you know, to make decisions when you are constantly hearing that from other people. So
Right, it is.
But yeah,
Well, did you
I
talk to
appreciate.
that clinic in Atlanta?
I just reached out. They said that I'd have to have a consultation, and then they're pretty picky about who they accept. They would want to make sure that they feel like they could help me before they would accept me, and I would have to go get a port put in surgically before I would be, you know, accepted at the clinic, basically. So,
Okay, yeah.
so I kind of got the ball rolling, but you know, it's still a little intimidating.
Yeah, it is.
But
Well, let us know what you find out about that.
I will. Yeah, I know the other thing I was going to ask was I've been looking at a San Diego clinic, and they do a lot of vaccines. Do you have any thoughts, opinions on all these cancer vaccines out there, like Dendrixel? And I mean, this clinic had listed like 8 or 9 different kinds, like NK vaccine, and I don't even remember all of them. But is that like chemotherapy where it works on some, it doesn't work on others? Or
Well, it
have
is
you?
like anything. It can work on some people and not work on others. And I think there's some benefit to them on some people, but you know, the studies are really mixed on those.
Yeah. Okay. So, all right. So just be careful moving forward with something like that, probably.
Yeah,
Just
just
there's not
keep
a
in
lot.
contact with us and let us know.
I will. Absolutely. Thank you so much. And I really appreciated all the info on the lymph system. That was super helpful. Thank you.
Good. You bet.
Dr. Connors, this is Carol Shulchevsky.
Hi, Carol.
Hi. I have a question. I've had a lot of lung congestion. Could any of the supplements I'm using cause lung congestion?
The only thing that would cause lung congestion is like if you're sensitive to something.
Okay.
Lung congestion like what?
Well, I've had this congestion in my lungs since about September, and we thought that it was me detoxing and the toxins don't have anywhere to go. And then we found out that my histamine, I have that defect for the histamine, and so I'm taking the histamine scavenger, and it does help. But I noticed today I was in the infrared sauna, and it helped quite a bit. But I'm just wondering why all this lung congestion. I'm wondering why.
But I mean, explain to me, what do you describe it as lung congestion, like a cough?
A cough once in a while. I'm out of breath when I like go up and down the stairs. You know, like if I do a brisk walk or something like that. I wheeze at night when I lay down. Sometimes in the morning when I get up, you know, I get up and I walk around, it gets a little better. It's just kind of like a heaviness almost. Because I've had asthma as a child, but it's not quite as bad as that. And when I cough, nothing comes up.
Okay, so we really need to do a differential diagnosis on that and see what that is. So wheezing is a constriction of the bronchioles. And that can be because of a sensitivity, maybe. Usually, you know, sensitivities to something, you're taking a supplement or something like that, is going to be more gut issues. But I could look at what I have you on again, and I'll reanalyze that and see what could be possibly adding to that. If you had it for this long, then you don't think so much of an infection. Has it gotten worse, or has it just kind of stayed the same?
At times it can get worse. It just depends. Some nights are worse than others. If I take more of the histamine scavenger, that helps.
Okay, so
But
if you take more of the histamine scavenger, then it helps. Then you think, okay, what is causing an increased histamine reaction? How about mold in your house?
no mold in my house.
Okay, let me think about that a little bit. Could be
Okay.
causing that.
And then I was going to get a nebulizer and have silver, put silver in it,
Yeah.
that colloidal silver to maybe help that. Do you
Yes.
think that's good?
Well, colloidal silver would help, but only if there's an infection.
Okay.
So
I think the worry is that it could cause an infection because it's always congested.
yeah,
Something in there.
trying to think what else you could nebulize. You could try doing nebulized colloidal silver. That's fine. It can't hurt you.
Right.
The other thing, just wonder if getting a air purifier with ozone would be beneficial too,
Okay.
like those ones we have in our office.
Yep.
You just buy them on Amazon.
Okay.
And putting that in your house, and especially if it's worse at night in your bedroom.
Yeah.
Still could be something in the air that you're sensitive to, something that's causing a histamine reaction of some kind.
Yeah, I noticed it like in September, and I had started on the detoxing in like end of June.
Huh. Yeah, let me think about that a little bit. I'll look at the stuff that you're taking.
Okay, thank you.
Okay. All right. Well, thanks everybody for participating. We will get this up on the Facebook page, and we will talk to everybody next week. I'll be praying for all of you.
Thank you.
Praying for you as well.
Oh, you have a question? Yeah.
Yeah, sorry, this is Claudia Vogren. I work at this time, so I'm never on,
Oh.
but I do have a question, if that's okay with you.
Oh, absolutely. Go ahead.
Okay, thank you. So as I'm looking at where I am, let's see, I had the Navarro HCG test recently, and so I think I've had the polyp in my colon that they said was precancer for maybe 4 or 5 years. So when on my first HCG test, which was in 16, it was 52.2. Then in 17, it was 51.8. And now I just got it done in February, it's 51.4. And that's still, it's like the index +4. That's, I mean, like, I really don't know how to read them. They would say that's positive, but I'm not sure. So does that say anything to you? Does that mean anything to you or not?
Well, you just want it to go in the right direction. And we've had a lot of people do the Navarro test, and it's correlated really quite accurately with PET scans and CT scans and changes in the tumor. So so we'll tell you if it's growing. So if your number is dropping, that's a good sign. So
oh, okay, that's good. And then also, since it's been, let's see, my colonoscopy was, let's say 4.5 years ago, and I had an 8 millimeter polyp, and
yes.
then in 6 months I did local. I went to a local cancer doctor. In 6 months I had another 4 millimeter polyp. And then and that was not with a colonoscopy, it was a sigmoidoscopy because it was in the rectum. So anyway, I haven't been back for anything since, for like 4.5 years. So I'm thinking it just may be a good idea just for, I just thought it may be a good idea for me to go ahead and have another colonoscopy since I did have some problems. Does that sound, the only thing now, when I had a colonoscopy, I have a really good doctor, so I didn't have anything They didn't give me anything to make me sleepy. He was really good, and it's just a couple of pains, I guess, going around the corners. So the only thing that I would be doing would be drinking all the things that I would need to drink to cleanse my colon. So
well,
do you think it's a good
I don't
idea?
think if it gives you a peace of mind, especially too, I think there could be benefit in doing that. So I wouldn't hesitate to do that. You're not doing a full one that could damage your ascending colon or something like that. So
Okay, so would you recommend then a sigmoidoscopy as
yes.
opposed to
Yeah.
colonoscopy?
Yeah.
Okay, that's great then. I don't remember. I kind of think they don't have me drink all that, but if they do have me drink stuff to clear that up, would that be a problem or
Well,
not?
maybe see if you can argue against it,
Okay. Okay, great. Wow,
because you
really
don't
good.
want that stuff with barium. That's a heavy metal, and that's not good for you.
Okay, well, this is really valuable. Okay, thank you. So I'm set on that. And then I had just posted something. I was thinking that I guess I was in contact with Michelle. By the way, it's wonderful to hear your voice.
That was me who answered your Facebook post.
Oh, that you? Oh,
Yep.
okay. So we'll have to see what you would like me to do for the next step, because I know that it is progressing, and I'm not really happy because I've been really sharp, but now I'm more, I forget things, and then I can tell I'm shaky too.
Okay.
I don't get, I don't get a good night's sleep. I go to bed too late. There's things that I need to be disciplined and not be so stressed about. So, there's some lifestyle things that I need to do, but either way, I need to correct whatever's, I need to fix this.
All right, so I'll pull your file tomorrow, and then either I'll contact you or I'll write up a protocol and email it to you.
Sure. Okay. Thank you very much. And then I heard you say something about updating rice programs. Is that something that we need to come in to
You
have?
don't need to do that. We can do that at a distance, and then we can send you the flash drive for you to put on your computer, so it makes it really easy for you. Okay. But I would like you to come in because I haven't seen you for about a year.
Well, oh, yes. So, that's what I was going to ask. I would much prefer to come in. So you recommend us going in?
Yeah, but I know that life gets busy and it's hard to do that. So.
Well, yeah, but I mean, this is our life or death thing, Yeah. I just feel like if I do it right, I'll live longer, and George too. Okay, so you do recommend us coming in. So when is the weather really bad at this time of the year, I guess?
The weather's beautiful. Tomorrow it's supposed to be like 2.
Okay. So when?
No, tomorrow. Today is actually really nice. Today was in the high 20s. Tomorrow is a cold. We're getting a little cold stream come through, and it's only going to be about 2 degrees. And then it's supposed to get back up into the high 20s again. And then you really have to watch the weather. If you're like, oh, I want it to be above freezing, you really have to watch it, because we can have a nice week that's, in the 20s and 30s, and then we can all of a sudden it can switch real quick and it can be 20 below. So.
Okay. So what month does that go until?
Well, that goes till August.
Right.
No,
Okay.
it's usually by April, then it's for sure going to be, you can still get down into the 30s, but usually it's in the 40s or 50s or 60s. So.
Okay. So we'll just go ahead and make plans. And I think one time we were going to come in and it ended up to be snowy. So we had to cancel, or freezing. I mean, like icy or snowy or something. We'll just go ahead and schedule an appointment for us. And Okay.
but
Well,
in the
I'll do
meantime,
that.
I'll still get that protocol put together and stuff. So,
Oh, good.
so we
Okay.
can go in on that in
Oh,
case you don't get here till April or May or something.
yeah, no, we will, I'm sure we'll get there pretty soon. So I'll go ahead then and get my sigmoidoscopy scheduled. So then hopefully I can have that done before I see you too. I mean, that's
Okay.
an
Yeah,
idea.
that'd be great.
Okay, well,
Very good.
thank you.
You are very welcome. Good to hear your voice again.
Well, yours too. And we just love everyone there. So
Oh,
we're
we
so
love you too.
for all of you. So, well, thank you very much. And I'll talk to George about getting in then.
Okay.
Okay, bye-bye.
All right.
Bye.
All right. Anybody other questions? All right. Thank you guys all for today. It was a long day, but I think it was good because people got some questions answered that we haven't talked to for a while. So we'll talk again next week. And again, keep on Facebook. And if you have more personal questions, post them on an email. Make sure you put a little tagline in the email that it's Zoom call questions and send them into our email. And we'll talk next week. All right. Bye-bye.
Bye-bye. Thank you.
Thank you.
Bye.